Welcome to the Studio Chat podcast. My name is Barbara Thompson. Each week, I'll be bringing you a self-care expert or a message to help you to discover how to live your best life and understand your mind-body connection. Thanks for spending some time with me today. Now, let the Studio Chat begin. Welcome, guys, to the Studio Chat podcast. My name is Barbara Thompson, and I want to say good morning or good afternoon or good evening if you're listening to this. I know I have a lot of listeners all around the world that listen to my podcast, so thank you for tuning in. And I'm sure if you've seen this episode number 67, I want to introduce Dr. Kelly Thornbury as a specialist plastic surgeon to my podcast today, and I'm really excited to have a chat with this woman because I've been watching her from afar for a while on her socials and watching her grow into her practice. And I want to debunk a lot of things about plastic surgery because as a professional counselor, I see only women in my practice. And what I see is this story of us, yes, there's body acceptance and there's being comfortable in our own skin, but there's so many ways that we can help ourselves through that. And there's so much, I think there's a lot of debunking that we can talk about today with all the stories that are tied to plastic surgery. What does a plastic surgeon do? And really get into the nitty gritty. So I just want to welcome to the podcast today.
Thank you. I'm very excited. And thank you for having me on.
Oh, I'm so excited. So before we go any further, I'd love you to introduce, look, I'm going to put your socials and stuff in the show notes, but I'd love people to introduce who is, and it's interesting when you talk to a doctor, there's a level of respect. So I always want to say Dr. Kelly, but as a surgeon and all the studies and all the work you've done, are you pretty casual that you don't mind people calling you Kelly, or do you like people to actually call you Dr. Kelly?
Oh, no, look, I think it's always Kelly. Yeah. I think my older patients are really sweet. They call me Dr. Kelly because I think they've still got that formality about it. But certainly when I was a junior intern, some people didn't know if I was the nurse or the doctor. So it was always just Kelly.
Oh, that's interesting because I think I've come from that generation too where I feel like it's disrespectful if I just call you Kelly.
Yeah. There's always that awkward moment. But I think when my patients get to know me, they just call me Kelly.
Yeah, but that's nice. And I think that's the start of this podcast today. It's like breaking the barriers of yes, you are. We need people like you in this world. You do the most incredible job, and I want to thank you on behalf of all the women for you stepping into what you do. So can you tell us a little bit about yourself, as in obviously what you do, but how on earth you got into doing it?
That's a long story. Look, it's a simpler thing, to be honest. I growing up, I just had a natural just desire, I guess, just to help people, and that sort of developed. And I'm not from the city. I'm from a smaller country town, and access to good education was quite a challenge. But I had some beautiful people around me, some mentors that essentially made education very, very much the key point. And then how I would then use that as a tool to do what I do now was never a pre-planned trajectory. I knew I wanted to do medicine. So I found the way into that. And, that was challenging, just getting into that and then staying in that and doing well at that. And then surgery is something that I found probably third year of medicine. I liked doing that. I feel like there was more a direct approach to having a positive outcome for patients. So when they've got a broken leg or something else, someone else came in with something, you just operate and you fix it and it's done. Certainly there's certain aspects of surgery, so neurosurgery and other forms of surgery that are a lot, less positive outcomes, I guess. So, and then look, I moved to Sydney and I actually started thinking I'd be doing orthopedics because I hadn't come across plastics by that point with my training, and I thought, well, that's what I like. That's the kind of surgery that I think that I'd be good at. And I'm actually too little to be up in a cavity all the time.
Wow.
So getting into someone's tummy and so getting into someone's chest is actually a bit of a challenge. So I thought, working externally is probably where I am best suited. And then, it was just a chance meeting with a plastic surgeon in an emergency department at St. George Public Hospital when I was an intern. And I got in trouble for calling the wrong surgical specialty. And then I realized there's this whole other world of plastic surgery. And then I was lucky. I just had met some people, and on the side of my job, I was spending a lot of time in theatres trying to figure out what all this was about, and if this is something that I'd like to pursue. And then I jumped on the bandwagon of training. So, and that's not easy.
Because it's a lot of people, there's so much misconception about when people, and I know I've got listeners all around the world, so we're just talking in Australia because there are different rules for different countries, but I think a lot of people get stuck when they hear plastic surgeon or they want to get some cosmetic surgery. Obviously, surgeons and doctors label themselves as different things, and you've got to be really wary that who you're going to has the right qualifications, has the right training, and is specialized in the procedure that you want done. And I'm pretty sure off the top of my head, as a plastic surgeon, you can correct me on this, that after med school, when you get into that specialty field, you do another, is it like another 11 or 12 years of training?
Yeah, exactly. So for mine, so I've done all the formal training in Australia through the Royal Australian College of Surgeons. So that's a highly selective, approach to doing a surgical training, and that's the only regulated body for Australia. So yes, that was extremely competitive, and I was so naive going into that. I just thought, great, I think I'll do plastic surgery, and had this, I think, beautiful naivety about it to start with. So I had no idea how competitive it was.
Oh,
And I was,
when you say competitive, what are you, for us people that aren't in medicine or anything, what
yeah,
was it like to get the top in the class, or what does competition mean?
yeah. So when you have a look at, when you finish medicine and you're a junior doctor, you then start to go, okay, I might be a general surgeon or I might be a GP. And then you've got to actually apply and get into one of those specialty colleges to do further training. And, for some people that takes 8 years to get in. I was so lucky. I was only my third year out of med school when I got into plastic surgery training. And, the luck, I think, is probably the bad word. I was working very, very hard, jumping all the hoops, doing the research, doing my master's. I was pregnant at the time. It was all, and I was working at Concord Burns Unit. So it's all a crazy bit of a blur. So it's competitive in the sense that you are working with and against, all the medical students. So they're already at the top of their category as far as academics go. And then plastic surgeons are maybe the top 2% of that.
Wow. And when you were training, what's the ratio of men to women in your experience when you were in the thick of it?
Oh, in plastics.
Yeah.
So plastics, it was it's flipping around now, but it was still, I think there was only sort of 4 or 5 trainees in Sydney when I was training, and that number is certainly improving. And there's a lot to be said for that. There's definitely a push to try and make facilitate females getting into plastic surgery and other surgical fields. But the challenges are always going to be is surgery is just hard. It's really just hard, and the training is plastic surgery is so broad. So my life in my late 20s to all of my 30s was 1 and 2 on call. I was in the hospital most nights, every second night. So it meant that I wouldn't see my babies for 2 weeks at a time because I'd be out all night operating, and then I'd leave home at 4:30, 5 o'clock to do ward rounds, and so operating by 7. So the training is brutal, which makes it unattractive. But if you get through the training, you've got an exceptional skill set.
Wow. And so through the training as a plastic surgeon, it's not just like liposuction or boob jobs or nose jobs, or like you do everything.
No, everything. Yeah. So plastic surgery, it's one of the broadest specialties. So, it starts with burns and skin grafts and skin cancers. And then you go through pediatric training with all the cleft lip and palate work and craniofacial reconstruction for all those little babies. And then hand surgery. So congenital deformities and hand trauma. That's a very big part of it. Maxillofacial surgery. Then you've got all the reconstructive surgery, which is all the microsurgery with breast cancer and head and neck cancer. So it is so broad. And then you've got all the aesthetic work. So, the rhinoplasties and everything else. And the beautiful thing about our training in Australia is we have, world-class training in Australia because we encompass so much in our general training. So when you're starting to do breast reductions and things like that, you're coming at it from this wealth of knowledge and expertise from every other surgery you've done on the breast, which is very good. And that's the challenge in trying to get people to understand, and certainly to be able to push in the direction of having surgeons who are qualified do surgery and understanding the difference with all of that.
Yeah, isn't it interesting that I'm like anyone else, that when I think plastic surgery, I just caught myself, and I want to put my hand up and go, wow, how insightful that the question I asked you. And what I said was, I said plastic surgery, and I went boob job, nose job. What else did I say? Did I say something else?
I know,
And
yeah.
the beautiful work, the cleft palate, and I felt so embarrassed all of a sudden as you were answering. I was like, Barbara, like, obviously my brain has been trained plastic surgery in that. And
Yeah.
surgery is so much more than what a lot of us, when we sit down and think about it, and that's why I just want to raise this quickly for anyone listening, then you might be listening to this going, oh, I'm the same as you, Barbs. I instantly, when I think of plastic surgery, I think of aesthetics.
Yes, and I think too, you won't think about it unless you need us in the reconstructive world. So unless your child has just jammed their finger in the door and they're missing half their finger, that's when you get to meet a plastic surgeon. And they're not elective scenarios; they're very much oncological or traumatic scenarios. It's the aesthetic and it's the elective world where people, I think, really that'd be most of their understanding of what we do.
Yeah, and I want to ask just the question as a general, like, as a doctor, I admire everything that you guys do in its entirety. I know the hours you pull are just demanding, and the kind of work you do, you can't switch off for the day. Oh, I really don't feel like checking in today. I'm just gonna like do it. I'm gonna be like, if you're,
No.
no offense to any of us that sit in front of a computer or whatever, oh, I just feel like having a half-assed day. I just want to kind of check out. How do you, in your profession, and we're going to talk about your self-care at the end of the podcast, but this just came up now, and I thought, you know what? I'm just really curious to know, in your profession, how the hell do you do all the night shifts, and you do like 18-hour days, and you have to be switched on? Like, do you learn as you go, or is there like some tricks that you guys all share with each other at med school?
No, look, I think I did that very poorly during my training. It was really just go to work. I was very lucky. I loved what I did. And I was so passionate about helping everyone. And I'm all in, you meet me and I'm just all in. I'm like, right, I'm going to get you through this. But, that was one of the downfalls is you're in a surgical specialty. And particularly at some of the training hospitals, I was the only one there, So if I didn't do the surgery and sort that out, then there was bad outcomes. So, I remember going to one hospital on a Thursday and operating until Sunday, and I was 7 months pregnant. And that's without sleep. So there was no self-care. There was none of that. You were just trying very hard to do what was right and turn up and get everything done. And I was lucky I was able to do that, but it's so challenging. And you forgo everything. So I was not seeing friends. I was barely seeing my husband. I had one little baby at that point. So everything is a sacrifice to do the training that we do. And I think when patients are meeting us and they're, you get patients trying to negotiate on prices and all these things, you're like, they've got no idea of the background.
Exactly why I wanted to bring this up today, because I know, touch wood when I say this, I'm lucky enough that I haven't had to have anything to see a doctor like you yet. Who knows,
Yeah.
But in the emergency response, I want to highlight this to people that I know the pandemic highlighted it, how in demand you guys are, and the hours, and just what you guys do to keep going, and just to give the medical professions just a bit of a break. Because I know when people see you on the emergency response in a crisis, everyone's like frightened and scared, and if you're the only doctor on, you are here, there, and everyone wants you, and then you haven't seen someone for 4 hours and they're angry at you, and they're, goodness knows you would have seen all sorts and heard all sorts. But I just wanted to bring attention to this as like, you're a human being. And that the fact that story, thank you for sharing that, because awareness is key. If we know what you go through, I'd love people to just have a bit more compassion for people in what you guys do, because Thursday to Sunday, any human being, once, if they're on a ward waiting for you, if they knew that, I'm sure they would have given you
different
passion, right?
Yeah. No, and look, I look back at it and think, sometimes there are so many moments where there are so many challenges, but you don't, in the training, there's not much time for us. Not much time for us.
It's interesting that the board or whoever you study under doesn't allocate, like, if you're not looking after yourself, who is? So we need you. And then it's always the people that are caring for us. You're not caring. It's the same with animals and veterinarians. The same thing is they are running from one room to another, doing all sorts of things. And I know that, they don't even get time to go to the toilet or have anything to eat.
I know.
Same with you guys, right?
I know. Yeah.
It makes sense to me, right? Should we start an academy that kind of says that teaching doctors self-care and teaching the institutes or teaching the medical schools and stuff, that should be the first paper 101 is how to carve time out just to sit for 10 minutes and have a coffee or go to the toilet or do something like that.
Yeah, and that's certainly the first thing I say to trainees when I'm meeting, and particularly the girls that are coming through with training. I'm like, right, number one, make sure you get your stress levels under control and know how to manage that, because I didn't have that. So I was flying unaided and with all of that, and it was intense. There's some really, really intense moments when I was at any given point I had choppers in the air with patients with big burns on board coming into Concord Hospital, and you don't, in those moments, you just get on with it, but then you also don't offload. It's because the next day is another day. So it's very important. I think if I got to do all of this again, I'd go in with a lot more focus on how to do all of that, because I'm only just getting to do that now.
Well, it's so easy to reflect back. All of us can. Like, if we don't know, we don't know. So in that moment,
no, that's right.
we're doing what everyone else was doing because it wasn't talked about. Especially now, I'm sure you go into hospitals, doctors are still the same. So you don't even see it around you, so you can't become it.
No, that's
only
right.
when you go through it and you get burnt out or really exhausted, or especially with the work that you would have done, it would have accumulated. It's got to go somewhere, right?
Yeah, that's right. Yeah.
And
I think,
sorry, I'm so passionate. I'm like, and the stuff that you see, how do you see blood and guts and flesh and organs and not like the smell, or like, how can you, I guess over time, do you just get used to it?
I think it's all context. So I grew up with with grandparents who had a cattle station. So I saw a lot of that. And I was the one who was crying and vomiting and passing out. So I think my family think it's quite amusing that I'm now the surgeon, because I was the one vomiting all the time. But I think it's context. So in the context that I'm in an operating theatre and I've got someone, and I've been in situations with, very badly damaged people, whether it's burns or motorbike accidents, and you just got to get on with it. So I think in that context, I'm fine. I've got my team, I've got, all of my instruments, I've got control. It's the context where I'm not in that position that is probably more daunting. But I'm fine with blood, although I don't handle raw chicken.
And you do breast implants, which a lot of people say that chicken breast is like a breast implant, right?
I know. My husband thinks it's hilarious. I get the gloves out to chop up the chicken.
Hey, whatever works. But isn't that interesting?
Yeah, I just can't touch it.
Oh, wow. Now everyone having chicken for dinner tonight's going to think of breasts.
Yes.
No apologies there. That's advertising for you. Chicken breast implants. Yeah, I really wanted to just talk a little bit about that kind of stuff, because we could have a chat about you're a plastic surgeon, this is what you do. But I really wanted to get to know you and your story, and just questions about the industry that I'm sure people would just like to know, but we can't, you can't really ask someone.
Yeah, like I said, I'm an open book. Fire away.
Oh. Yeah, I'm literally so excited. I'm just and I want to say congratulations on opening your practice in Double Bay. It looks
thank you.
It's so beautiful.
Oh, thank you. It's so dreamy. So you know what? I think I've worked in a lot of hospitals, a lot of practices, and I think when women come in, there's most ladies, by the time they see me, they've been thinking about this for 5 years. And there's this big negotiation in their heads going on, can I afford it? Should I take the money out of the family holiday? Should I take the time out of the children? There's such a negotiation happening. And so I just wanted a space that was just really nice and relaxing, more day spa feel than such a clinical environment, which is more intimidating for patients. So they can just, relax for a moment and then have a chat about whatever it is they're wanting to chat about. And, I designed it and my husband built it. So, and he's just delivered. I love it. And it's such a beautiful space.
I just got goosebumps when you said that your husband built it. That is.
He was quite funny, but he didn't. I had a few curves in him. He was trying to get me out of the arches. I was holding tight.
Yeah, good. That's the least that you should be able to have in your practice.
That's right. I want an arch.
Yeah, it's lovely. And I love the idea of the day spa too, because when we think, again, I was a perfect example earlier on in our conversation, when we think of plastic surgery, we instantly think of aesthetics. And there's a lot of traditional thoughts about plastic surgery. If we can just talk about the aesthetic side of things for a moment, there's a lot of traditional thinking that I don't want anyone to know, or I'm selfish, or now with body image and now with women, like there's more awareness of being more comfortable in your skin and understanding that we are all really different. No matter if we eat the same and we move the same and we sleep the same, our bodies are still, through genetics, but through how we treat it and through different pregnancies and stuff, it's going to look so different. And there's the awareness of that. So I think it confuses women even more now, because they're like, I want to have bigger boobs, I want to have smaller boobs, I like to have a bit of lipo or a tummy tuck, or I want to have something, but how selfish am I to have that? But also, especially if women have daughters, I think there's this whole shift in what am I showing my daughter if I want to change my body? Am I showing her that you can't love the skin you're in?
It's so complex, and I don't meet a single patient of mine who, and I know they've juggled this, and I think that's why they take so long to come in. And that's a good thing, because by the time they come in, usually they're just making sure I'm the right fit. They know they want it. They've negotiated in their own mind, and they've balanced all those different views and opinions. And I certainly have patients who come in and particularly my younger patients, they will have someone who's older around them sort of having a very negative feedback into this whole idea of why they want the breast reductions. I do a lot of breast reductions, and it's very challenging. And I think it's the simplest thing. If there's something that's bothering you and it has enough of a negative impact on your day that you think the surgical risks are outweighing not having it done. And obviously, if there's this whole new thing coming in now with body dysmorphia, and it's not new, but it's very rare. Yes, we screen for it, but it's okay. If there's a surgery to fix what you're concerned about, and you're understanding of the risks, and even if we have a problem, you're still thinking, okay, I'm still so glad I've done this because I'm still in a better position than I was before, then that's fine. It is definitely becoming more talked about, but there's still, if we get to change that narrative a bit, that it's not about the risk profile, how this is going to work for you. And I say no. People don't like it when I say no. But if it's not safe, it's not safe. So there is so much that people want to really have a negative narrative around. But for the patients that I work with, there's a really beautiful change for them, which is nice.
And the patients that you work with, so you mentioned breast reductions, that's a lot of the work that you do. And is that mainly women that genetically have big boobs and are self-conscious of them, they get in the way, or they have a sore back, or?
Yeah, look, breast reduction, it's a beautiful surgery, and it certainly delivers on what it's supposed to. So most of my ladies will have a very heavy breasts, and it has a negative impact on their day. Those ladies so many moments of their day are defined by the size of their bust. There's unwanted negative male attention. They're wearing 2 or 3 bras. They're wearing minimizer bras. I've got ladies who wear wetsuit material minimizer bras. And it's just really hard for those girls. And often when they're younger, they've got this tiny size 6 waistline and they're in a size 14 just to get around their bust. Their necks are really sore. So the breast reduction, that is definitely the most common surgery I do. And that's a functional as much as it is an aesthetic surgery, okay, with the improvements those women get and the freedom that comes along with having a bust that matches your body.
Yeah. Yeah. And I can relate to that too. Like I've always had a bust and you get defined by it. Like I can't tell you enough people that, my name, not unfortunately, I love my name. I'm named after my grandmother, but it's always like Barbara with the boobs. That's kind of how a part of it. So you get defined by it. When people, men and women, like, as a female, when someone's looking at your chest, even the ones that do the side eye, and I would catch people and go, you're looking, how do you know? And it's difficult sometimes because you're so grateful for them because, a lot of women don't have them. So there's that kind of bittersweet again, how you said people come in and for 5 years are thinking about it. When you talk about a particular part of your body, when you're really grateful for it, you still have moments of, wonder what it feels like to be flat-chested. I wonder what it feels like to not have boobs.
Yeah. And look, patients come in and they're like, right, I'm done with this scenario. Take as much as you can. And then other ladies come in and say, look, they're still part of me. And there's so much of my identity tied up with how big my boobs are. So, we might make them a little bit fuller than taking as much as I can. And that's always just a nice little collaboration between me, what I can do and what I can deliver safely, and then what their desired outcomes are.
It's so beautiful. So you're a specialist plastic surgeon, a reconstructive and cosmetic surgeon. So what surgeries do you actually do in your practice?
So now I've had this beautiful transition and evolved with my practice. So when I started out privately, I just started to really attract a lot of women, which was lovely because when I was training and I was spending a lot of time with a surgeon in Sydney, we had a visiting surgeon come up and he said that women wouldn't come to me for breast surgery because they do it for men. And I was taken aback for a moment, and then I realized you actually have no idea about women. So it's just been this really beautiful, natural, organic kind of growth, actually. So yes, I did a lot more training in breast after my actual formal training to make sure that I'm a type A personality. So I want to make sure that I'm sitting in front of a patient and I'm confident that I can deliver a beautiful result for those patients. And when they're coming to me talking about nose or face, I don't do so much of that anymore. So I certainly send them elsewhere because I think they would be in better hands with someone else. And most of it is breast and body contouring, which is nice. It's fun. And I meet the most incredible women. I learn so much from all these different women, and it's beautiful. It's a nice day.
Oh, I love that. So you do the breast work and obviously like tummy work as well, like so for the summer
tummy tucks. Yeah, that's right. And that might be through massive weight loss or babies. I do a lot of labiaplasty surgery, which is nice too. I guess it's nice having a female option as far as a surgeon goes for that kind of surgery. That's one of the fastest growing surgeries in Australia, but no one will tell anyone about it.
Let's talk about that for a second. So is that the surgery? Obviously, is it I know parts of your body down there change over time and little bits start hanging out when they weren't hanging out before. I think that's happened. But is it obviously from an aesthetics point of view, but sometimes it's for a comfort point of view too for women?
I think I've had 3 or 4 patients come in purely aesthetically. Everyone else who comes in, they've got so much tissue that it's genuinely uncomfortable. It's uncomfortable with exercise. It's uncomfortable just wearing gym tights. It's uncomfortable during sex. Everyone has a discomfort if they've got too much tissue.
Yeah. And what is that tissue called? That kind of is
just the labia minora. Yeah.
And does that grow and change over time, or does it stay the same and just?
Look, it can. If you fluctuate in weight, or if you have a couple of children, it can fluctuate a little bit, but not dramatically. Not dramatically. The labia minora on the outside, it can change as well in response to weight and mostly weight, really. So it is But when you're kind of looking at that whole area, you're kind of trying to balance everything. So what brings them in will be the excess labial tissue, but do they have a clitoral hood excess as well that you need to do some sort of reduction for that, or maybe a minor fat grafting, things like that we're looking at just to balance the whole area.
Wow. So that whole area, not only is it obviously aesthetically, obviously it makes them feel a bit more comfortable and a bit more like literally comfortable, but also
It's just comfort. Yeah.
Yeah. But also
Yeah.
for pleasure as well. You said that obviously around the clitoral area, you can kind of make that a bit more open, or
Yeah. Just reducing the bulk in that area. It's just about balancing. If you do a labiaplasty and you don't address clitoral hood and there's excess, it may just look a little bit more prominent. So all of a sudden you've just changed that balance. So it's just about going, okay, if there's something there, I'll point it out. You don't have to do it, but it's just so you know that that's going to look a bit more prominent when I've tucked everything back up.
yeah, I think having a woman
Yeah.
would be, and you have, I've noticed that when women come and see you, there's an option to have a full women surgical team as well. So it's only women in the.
Yes, yeah, no, I have got all women except my assistant in Wollongong, Tim, and he's amazing. But yeah, and you know, my anaesthetists are beautiful. So they're all women. They just care and they love their jobs and they're so good at it. But to give you a point about why that's so beautiful and why I really appreciate that is they actually call their patients the night before the surgery or in the week leading up. And so by the time you send me, you know, I always have had 2 consults. I know the new July changes mean that all the surgeons have to have 2 consults, but I've always seen my ladies twice because I just can't get through all the information. I can get through it all in one consult, but I just love giving you the opportunity to come back and ask more questions. So that's what I have always done. And then my anaesthetist will call the patients in the week or so leading up. So then you know me, you know your anaesthetist, you know the plan, and you know your team. So then you will always feel anxious going onto that operating table because you're sitting there thinking, oh gosh, do I really need this? What am I doing? Um, and that's the difference with these elective surgeries. And it's not like you've got a cesarean that needs to happen urgently or an appendix that's just about to rupture. You just need a surgery. You don't have an option. This is the challenge for an anxiety provoking kind of thing leading into these surgeries. So if my team are all over it and looking after you as best you can, then hopefully we ease you into it. I still have to do your marking up, which takes about 20 minutes before we can give you the good stuff. But
Yeah. And this, I think I love that because it's any part that you can really see and hear your patient, like really make them feel supported, because it's such any part of the woman's body, I think, is very vulnerable when you have it out. It's very vulnerable knowing, even when I got my wisdom teeth out, they were impacted. So I had to go to hospital and get totally knocked out and get all 4 of them taken out in my 20s.
yeah.
And I did have a thought. I was like, what happens when you're asleep on that table? When you're naked, do the surgeons look under and go, oh, yeah?
Look, to be honest, it's such a professional environment, and everyone, certainly in my theatre, everyone is there just to genuinely take care of you. And you know, there's certainly been, I know when people are super anxious, and particularly my younger patients, I'm literally holding their hands while they go off to sleep. Like, okay. And once you're asleep, we just get everything done. We wake you up, and yeah. So it's such a professional environment. You don't have to worry about that. But it's a thing. But it's just this uncertainty. It's something that's completely foreign. And then I think the big thing for a lot of my patients is you don't have control.
Yes.
Yeah.
And it's the unknown that you don't. And I think too, if we can talk about when we wake up, when patients wake up, the pain is something that I think is a lot of fear around the scar, like obviously the scar tissue and the pain, I think would stop a lot of women moving forward with the surgery too.
Yeah, and you know, breast reduction, thankfully, that's the nice one. You know, it's different to augmentation, it's different to tummy tuck. They're certainly different. They're more painful procedures. But the breast reduction, my patients, you know, they're off medication by day 3. We're doing everything. We're doing lots of local anesthetic. We're making sure they're comfortable with their analgesia regimes after. But they're pleasantly surprised as to how comfortable they are with that, which is nice. But no one believes me.
Well, no, not when you get sliced open. I mean that in the most nicest way with heaps of stuff. But you know that it's going to hurt a little bit, you know?
Yeah. I mean, you certainly know I was there, but most of them say it just, you know, it feels like a bruise more than
Oh.
something else, which is good. And I think it's probably more indicative that I'm not doing anything internally. I'm not going into the abdomen, all those sorts of things. So appendix and all those sorts of procedures are certainly more painful. Yeah.
Yeah. Do you have a favorite procedure? Are you allowed to say that as a plastic surgeon? You have a favorite?
Yeah, sure. I sure am. Yeah, it's breast reduction.
Yeah, I can see that.
It's not easy. It's not easy. It's a challenging surgery and everyone is so different. Even the breasts on the same patient are so different. Um, but it's a big win for the patients. And so I've kind of spent years refining that technique to make sure I can deliver and make sure it's as safe as we can make it. But it's always the big win for the patients.
Yeah. And the tissue is taken from underneath? So do you actually underneath the breast, that's where you open the breast?
That's right. So that's where most of the volume, what I would say is pathological volume. It's the bit that's sitting on the tummy. It's the bit that's weighing everything down. So that's definitely most of the volume that I take is from there. Then some out of the side as well. I can't take anything sort of from the cleavage because that's where your blood supply is coming down. But a bit out of the side and a lot out of the volume. And then we tweak just to see what you want and what I can deliver safely as to what the goal is.
Yeah, it's so beautiful. And with breasts, when we talk about breasts in general, like whether it's a boob job or it's breast reduction, have you noticed the trend coming forward of people wanting more natural, or do you still have people that are really happy to have a really good old-fashioned boob job?
It's, what, I haven't in my practice, I think I just attract the clients who would prefer something more natural. So even for the implants, I still do a lot of implants, but they're very much a more conservative population, I would say. And that works nicely for me because I am certainly more inclined to try and do that for a woman because mainly it's going to avoid further complications down the track. If we've got really big implants, that sets us up for problems further down the track sometimes. So, and most of my patients, they just come in and they just want to restore the volume they had if they've had their babies. And be braless and comfortable without all the padding in their bras. And for my younger ones who've never had breasts, they just want to ditch the padding and feel comfortable just to fill out a dress. Okay, so most of them don't want anyone to question they've had implants. And so it's a nice. I just have a beautiful patient population because of that, I think, which is nice.
I love that. What about so you just mentioned, like, obviously with weight gain, weight loss, children and age, our breasts start to travel south. So
yes, yeah.
if someone had saggy boobs, is there a procedure just for that, or is it normally a lift and an implant or lift and a reduction, or can you just have a lift?
Oh no, you can definitely just have a lift. And I've got patients who come in thinking they want implants. And if you're too low, I have to lift you first because I can't just put an implant because then the implant just sits down on your tummy as well.
Yeah.
So often you need to do the lift. And I do that surgery. It's a bit contentious, but I do that surgery in 2 surgeries. So I will do your lift first and sit you tight for a year before we come back and put an implant in. And that just means all the tissue has settled. I've got you into this beautiful position back on your chest. So you've got really youthful breasts. And then if you still want volume, then we come back for implants. But so many of those women won't come back for implants because they're just happy that breasts are up, they're braless, they're comfortable. They may not be back for volume, which is good.
Can you be braless with just a breast lift?
Yeah.
Oh.
I know, imagine that, right?
Oh, you're selling it.
Hello.
So I'm not allowed to say that. No. But so how is the procedure done? Is it like, because I'm a woman that has a good, decent boob size, so I'm thinking they're quite heavy. How do you lift it up?
Look, it's the same procedure as the breast reduction, except when you're just doing a lift, you're really preserving volume. Because if you either need a reduction or a lift, but if you get a reduction, you get a lift as well. Okay, so it's the same surgery. So one is either taking a lot of volume off because you've got the neck pain and the back pain, and you've got your posture's hunched, you've got rashes under your breasts. So if that's the case, we're taking a lot of volume off. But if you've just deflated your breast and you've got more skin and the nipples drop down, then that's just a lift. So it's exactly the same surgery, but I'm trying to preserve as much volume as I can and just rearrange. And that focuses largely on just repositioning the nipple and the breast back onto the chest, and then getting rid of all that excess skin, which lets you drop down.
Yeah. And do you do any nipple work? Is there any like aesthetically any common things that you see with women's nipples that they want to improve?
Yeah, a lot of you know, it's not particularly common, but I do nipple inversion surgery. So some people naturally have inverted nipples. So yeah, that's a surgery that I would do, but that's usually only under local anesthetic in the room. So that's a quick one.
Wow. Oh my gosh, so fascinating. And you're really big on educating your patients, and I think that's something that when I saw what you do, I really want to create this platform for you to be a direct connect to my audience and for it to normalize all of this. What's the biggest misconception that you've found in your practice when it comes to plastic surgery? Is there a common question that people always ask you, or after the surgery they're like, oh my God, XYZ?
You know what? I think that's an interesting question. I don't think there's probably so many misconceptions about, and that can be attributed to how much is on social media as well about all of these different things. And I think, there's this whole idea that women are having plastic surgery just because they're trying to keep up with Instagram models and everything else. I honestly, genuinely don't find women coming in saying and bringing an Instagram model in and saying, I want to look like this. This is what I want to be. I think certainly my patients, they just want to be the best version of themselves. They're not trying to be someone different. They're not trying to be the Kardashians. They're not trying to be anything more than just the best versions of themselves, and that's okay.
What was that saying that you said to me before we started recording this morning?
Oh, you know what? Yeah. It was one of my nurses said to it. She said to Kelly, it's so simple. If you look good, you feel good, and you do good. And it's the simplest thing. And I think that rings true for so many people in so many aspects of our lives. If you just show up and you're feeling good, you'll do good.
And it's not your fault. A lot of women would blame themselves. We're all kind of got this model that we have learned to hate our bodies and learn to hate ourselves, and we can celebrate our differences, but we can be comfortable in doing that. And just to think of plastic surgery as an option, like as a, that.
Yeah. And I think certainly the changes that came in on the 1st of July this year, have been very aggressively targeted towards making sure, you've got qualified surgeons, and we're not making this whole process of having plastic surgery very easy for patients, because there's risk, there's surgery, so there's risks. But I think the nice part of that also will hopefully mean that patients who are genuinely interested and genuinely will benefit, and if that's functional or if that's just psychological, that's okay. That's fine.
Talk about these changes, and you talked a bit about them on your social media before the 1st of July. Part of that is not being able to put testimonials up.
Yes, yeah, and look, that's always been a thing for doctors. We've not been able to have testimonials. So it is. Social media has changed that in so many ways, because I think once a woman has a surgery, she's feeling amazing, and she wants to share, and she wants to. My patients, I never used to do photos and put things up on social media, because I think as a female, I was worried that I'd feel like I was exploiting my patients, and that's why they were coming to female. I would understand all of that, so I never. And then I started because patients are wanting to know your work before they come to see you.
Yeah.
So I'm like, okay, if this is helping patients make decisions, then I'm happy to do that. And my patients have been so beautiful. And now I get hounded if their pictures aren't up, because like, well, you're not happy with my results. I'm like, no, I just haven't had time to put them all on Canva yet.
That's amazing.
So it's more like you're empowering the women to actually help others, because they found it so helpful having the before and afters. They're like, put my photos up. But if you ask them before their surgery, can I use your photos? They will say no. But it's after their surgery, they're showing everyone their outcomes, which is nice. It's liberating for them too. But then it's so beautiful. They just want to help other women make decisions. So yeah, we can't use testimonials. We've never been able to, but it has limited, what even our patients can share on their own platforms, we don't have control of that, but we certainly can't repost those sorts of things.
Yeah.
The whole push is aimed to make sure patient safety is improved in Australia, and it hasn't really had much of an impact on my practice because I've always had 2 consults and I've always had a lot of time with these patients. So, and I'm not one of the high turnover clinics. I'm very much boutique, have a lot of time with my patients, make sure everyone's happy and safe with the plan. So that hasn't really changed what I do, which is good. But I still really want to push forward with all the education on the socials, because I think that does help women make decisions. And whether or not that's me or their surgeon in Melbourne or their surgeon in the States, we've got, a pretty broad following now, but it just helps them ask the right questions and think twice about things that they're not so sure about.
Yeah. It's because I think the photos are good too, because we all want to see someone that looks like us, kind of, in the before and afters. And I think as nice as any industry, not just your industry, the fitness industry, and there's always, that's the biggest draw card for people is, the before and afters. But
yeah.
in the plastic surgery sense, it's more like, where is there a body kind of like mine? I may get results. So it's almost in that thought process, what we can see, we can become. So I think it comforts women, if they're choosing plastic surgery for the right reasons, that seeing these before and afters is a different way of looking at it, is a really great resource for them to say, okay, this is what this looks like.
Yeah, and I think you do get a very broad understanding before you even come and see me. So patients are very well educated. They know, okay, this is the good, bad, and the ugly of what can happen. There's certain forums all over Facebook and things like that, so which again, women are so happy to go on and share their journey, share what's happening, question what's happening, all those things. So there's these really beautiful communities of support out there. There's some communities which are a little bit anxiety provoking as well. So I don't encourage some of those groups, but certainly my breast reduction patients, there's a couple of Facebook groups that they've told me about, which seem to be just beautiful, supportive communities, because you don't always know someone who's had the surgery. And I can tell you everything I want to know, but I've not had the surgery. So it's nice when they've got support.
Yeah, because you need support. I think that's one of the things, and it still can be kind of a secret procedure. And same, we spoke about it before we started recording, is you and my industry and your industry is totally different. But what the similarities is that a lot of people can do this type of stuff, work with me or work with you, and no one knows.
No, and that plays into so much of what I do, and even the design of my new clinic. It's just so, most of the patients would be here and no one knows that there's another patient in this clinic. The way we kind of transition them between the rooms, so the consult and the quoting room. So, and I try and time it so it's really only you in the office at any given time, and you won't cross paths. It's such a private experience, because I get it. Women, particularly when you're just meeting me, there's a certain vulnerability about it all. You're uncertain, you're nervous, somewhat stressed about it all. So if I can make that nicer, then that's good.
I love that you shared that, because I have the same. How I function, my business is, when you come here to my practice, no one sees anyone. There's no one out in the waiting room. You come in, and I always joke with my clients to say, unless I balls the appointment booking up, which hasn't happened yet, but could happen. You're never see anyone. And that's beautiful. That I think that shows your continuity of care. And I'm really and I can see through everything that you've worked to this point, I don't know why I'm struggling to say that word.
Continuity.
Thank you. It's always one word on a podcast I'll sit on, like, why can't I physically say that word? You've noticed it from start to finish. You've really thought out the process. As a woman, obviously, you really get it. This whole surgery comes with anxiety, and every woman, or most women sitting in front of you, have a story, want to share it with you, and it is and most of the time it's something that's really upsetting for them. It's really difficult to talk about. Maybe it's some things I've never voiced to someone before. So you're having someone, and we're both similar in that sense, that when people first meet us, it's a stranger, and they're opening up to you and telling you something that they probably never actually verbally said out loud before.
Yeah, and I get, I feel like women have a nice space with that with me. Just being female, it's the simplest thing. I think it's just, I feel like a lot of my patients tell me a lot more than they would tell my colleagues, my
Yes.
male colleagues.
Oh,
And
100%.
that's not necessarily a bad thing. Or a good thing. It's just, I feel like they just, they feel a little bit more, there's less barrier to that, I think.
If I can speak bluntly here, I think it's you.
Uh,
And as in we're doing this podcast and I've met one plastic surgeon when I'm just had to cast my mind back quickly. I played competitive netball really heavily. And I think I was about 16 and I've still got the mole on my back. I've had it checked, it's fine. But there was a big mole and my parents aesthetically didn't really like it and wanted it removed just in case. And so I went and saw a plastic surgeon because I personally, I'm not embarrassed to say this, but I'm really afraid of scars and I'm really afraid of that kind of stuff. So it's still with me today. And so when the plastic surgeon looked at my back, he said, yeah, I can remove it. There'll be no scarring, but
oh,
you can't play netball for, I don't know, it might have been, after that type of surgery, it might have been 6 weeks. I don't know. But as soon as he said you can't play netball, I was like, no, I don't want it. I'm fine.
I'm out. No, thanks.
So even I went down the track of, okay, well, if you want surgery, I said, I don't want a scar. And then we apparently found, who knows if he could have, who knows? It could have been all BS. But I'm just trying to think, have I met any plastic surgeons? But you have, I know this is the first time we've met. I followed you on socials for a while, but I work with people every day and I can see your ego when I see one and you don't have one. And you know how
It's
refreshing that is.
yeah, I think I do get told that. I just do what I do, and I'm lucky to be doing what I do, and I know that. So I have the training was brutal, but I was lucky to get on. So many people didn't get onto training, so they didn't get to have a career that I've had. And I'm thankful for that and grateful for that, and I'm grateful for the patients who choose me. It's nice that they decide, okay, we'll let her figure out if she can do something. That's a very nice thing for patients to do.
But likes attract likes. So
Yeah.
with your practice, and I'd love to know now with you running your double bay practice, how are your hours looking? Are you being able to be home with your girls a bit more, or like is it still long hours?
Yeah, it's always long hours, and I think that's relative to a lot of other jobs. But I'm closer to the girls and closer to their school, and that's. I think I had a mentor years ago who said, just keep a circle tight. He said, keep that radius of where your hospitals are and your clinics are and everything else tight, because that means that your days are a lot better. I mean, there's certainly still days where I'm up at 4:30 rounding at 3 different hospitals before I start operating at a different hospital. And but it's getting better, but it's a dynamic process, and that's okay. I'm just trying to make the right decisions along the way to make sure the priority is just being able to deliver something really beautiful to the patients. And like you kind of alluded to before, if I can simplify everything with my life, then I can deliver, because it's not easy showing up with 100% every day. And there's no way I can't show up at 100% every day.
That's what I mean. Like we did have a bit of a moment, like a bit of a chuckle about it that, I want to check out today.
Yeah.
And look, I'm sure there are some surgeons that do and can still perform, because there is a level of genius. Honestly, you cannot say the work that you do and other surgeons around the world you're very special and you've worked really hard to get there, but you've got to be a special person to do that work.
Yeah. But you know what? You've got to love it. As long as you love it, you're okay.
Yeah.
I think like every other job, if you didn't like it and you weren't surrounded by people that you wanted to be around, I have the most amazing teams in all of my hospitals and in my practice. It's a nice day. And then I get to meet really beautiful women and figure out how I can help them. And my favorite thing is just seeing the post-op patients. They come in and they're just different. It's nice.
That's so nice. So as we're just starting to close off the episode, one more question about like the hospitals and stuff. Do you choose where you get to work? So do you have like you mentioned 3 or 4 hospitals that you work
Yeah,
at?
I've got 6.
Oh, okay. And are they based
Yeah.
all Sydney, South Coast?
No, there's one Wollongong, St George private, St Luke's private, Bondi Junction private, Prince of Wales private, and Karina private.
Wow.
Yeah. So yes, I choose, but it's always difficult getting operating time too. So you've got to apply, you've got to go through the process, but then you've got to be able to fill those lists and with patients as well. So it's always a process.
Amazing, because it's a world that I'm so far removed from. So just hearing you talk about the process, I'm like fascinated by the process. Right. Okay. So is there one thing that you'd like to leave with my listeners today? It can be anything about your practice or what you do, or just something that you'd like, because I know that whoever's clicked on this podcast could be in a couple of camps. They could be like, I actually want to get some surgery done, and I want to listen to Kelly and see what she's got to say, or they've got a friend that might be having some, or maybe just out of general curiosity. So what would you like to say to those women that are listening to this podcast right now?
Yeah, look, I think the first thing I really want to say is just to celebrate all the small wins, because I feel like as women, we don't. We're like, yes, I've got patients who come in, they say, I've only lost 5 kilos, no, I need to lose another couple of kilos before the surgery. That's a massive win. But they don't, none of us slow down to celebrate our small wins. That's number one. And I think I don't do that very well at all. The second thing is plastic surgery, in any of its forms, it is designed to deliver a functional and aesthetic change. And a lot of my patients will have functional concerns, neck pain, back pain, if their tummy muscles are separate, all those sorts of things. And then I don't necessarily think that a functional concern is more important than a psychological concern, as far as I just would love for my jeans to fit without having to hide them with my handbag when I sit on the lap, or I would just love for my boobs not to be as big and draw all this negative attention, or I'd love to have some boob.
Yeah.
And I think that kind of psychological aspect, I think there's so much negative focus on the psychological reasons that women do surgery. And I don't necessarily think that that's less important than the functional reasons. And I don't think the psychological gains are any less important than the functional gains of the surgeries that I do. And if you ask any patient who's had a breast reduction, how do you feel? They're like, I'm amazing. And then I'm like, I have to prompt them. So how is your neck pain? They're not thinking about the neck pain that is now gone. They're thinking they can wear these tops that they've never been able to wear. They now have proportions. They look thinner, all of these things. So I think it's a little bit disappointing when there's so much focus on the negative process of the psychological content when it comes to all these different surgeries, when it's okay. If you just want to feel better, it's okay.
It's more than okay, isn't it?
Yeah. If there's a functional reason, sure, that kind of makes that. I think that validates women's desire. They're like, oh, but I've got neck pain.
Yeah.
I'm here, I've got my neck pain.
Yeah.
And it's okay if you just want to have smaller breasts so you fit into a top, or you just have smaller breasts so when you're running it doesn't hurt so much, or when you're doing whatever you want to be doing, it's you feel better. I think that's the challenge, is that we have such a negative approach to the psychological benefits of these surgeries. And why do we think if I just want to feel better and look better, why is that a bad thing?
Worried about what other people think. We're worried
Other
about
people think, and then other people put so much focus on body positivity. And yes, I'm a female, I'm a mum, I've been through it all. We should feel comfortable. We shouldn't have that pressure. What's driving that pressure? But at the end of the day, if you're not clinically depressed, clinically anxious, BDD, all of those other things that are confounders, and for those patients, we know that surgeries may actually trigger something and may be far more complicated than we anticipated. I think it's a win.
Yeah, there is no shame in getting plastic surgery.
No, no, no. But I think the focus has certainly in the last couple of months has been around, trying to make sure we're assessing patients for all these different things. But that was already happening. Certainly in my
Yeah.
clinic, that was already happening. Now they're formalizing it. That's fine. I think the main thing is just making sure you know who your surgeon is and what skills that they've got.
And asking the right questions, like how many times have they done the procedure? How long have they been a surgeon for? Is there any, those type of questions?
Yeah, I think it's those type of questions and understanding, like, there's different bodies in Australia so the Australian Society of Plastic Surgery and ASAP, which is ASAPS. If you're affiliated with those bodies, then you're fully trained, and it's understanding how to access a list of surgeons who are fully trained to help women decide which way they're going with the surgery, and to make sure they've got access to really good surgeons. And Australia has fantastic surgeons. We have got very, very highly trained surgeons, which I'm very sort of lucky and proud to have been, able to do.
Yeah. No, I love it. I love it. So we did touch on this earlier in the conversation about looking after yourself. So what's one thing that you do for yourself now to care for you?
You know what? It's my biggest change since having a bit more mental space since finishing training has been intermittent fasting. Now, and I tell all my patients about it. The science behind it is incredible, but for me, there's days where I cannot do my training. There's days where I can't, I just don't get space. I'm up, I'm working all day, I've got the girls, I'm getting them running around doing things with the girls in the afternoon. So intermittent fasting has been and most people would think that's not really, something for me, but it absolutely is. There's so much that comes with that. And as far as longevity and weight management, like the whole thing it's very impressive. And Dr. Mindy Pelz is my reference.
Stop it, because I've just read her Fast Like a Girl book.
Fast Like a Girl.
Yes. When you
Yes.
said intermittent fasting, I was like, get out of here. The last month I've been studying her and learning about her work, and I've got a nutrition background. So
Yeah,
I'm
okay.
always, and because obviously I'm a counselor, so I tie the mind and the body together with my ladies. And so when you said intermittent fasting, I was like, because it's the clarity of the mind. And that's what you need, right?
It is. And I mean, I've certainly focused more about sort of personal care in the past couple of years. Certainly when we couldn't operate, that was really hard for surgeons because, for me, when you're operating all the time, your hands are very skilled. But when you stop operating, they shut us down for 2 months at a time for a couple of times.
That's right.
And there's a lot of stress that comes with that. And, my hand's going to be strong enough? All those sorts of things was coming into that. And just an anticipation of the cases that you had coming up, you have more thoughts about, okay, if that happens, am I ever going to be able to do that? All this time kind of was actually not helpful when you're a surgeon and not being able to do your job. So that's when I started to reposition a few different things, mainly focusing on getting the exercise, but also a lot of meditation work, and certainly helping my girls with that because I'm not spared the stress of the job, and then I'm also carrying the mother role, which I adore and love and want to do really well. And so there's not a lot of space left. So I jump into bed with my little girls. I've taught them how to meditate, and which is such a powerful thing. I think that would have been so good if I had that skill when I was so young. They know whenever something's stressful or they're away on camp or something, if they just do their deep breathing, their box breathing, they can control it, which is so powerful.
Yeah, and it's free and no one can take it away from them. And half the time I say to my ladies, especially the ones that have little kids, always around their ankles, and even when you sit on the toilet, they sit on the toilet and they still don't have time to themselves. I said, all you can do is while you're sitting on the toilet going for a pee is breathe in. Like I give them the breathing exercise. Or if you're in the car or you're sitting at dinner a dinner party, if you quickly just excuse yourself and go to the toilet and do your breath work, no one knows.
No. No, I know. And it's powerful. So yeah, it's look, there's still a lot of room for work with me. But I'm obsessed with intermittent fasting, and I'm obsessed with the benefits for health with it. And I've got a lady who's lost 38 kilos doing that.
How much?
38 kilos.
Following like Dr. Mindy's how because she that Fast Like a Girl is all about intermittent. For people that don't know, this doctor in America is all about most people think of fasting as 16-8, but when you that only will serve you for so long, but you have different autophagy kicks in at about 17 hours or 18 hours, and that's when the body starts really healing itself. But then it was interesting with her book, and it makes sense, especially perimenopausal women and women going into menopause, that every week of your cycle, your body's doing different things. It needs different foods, but you fast to, and this is only a guideline. So 15 hours, 16 hours, 1 week, 17, and then you can do 24 if you want, but it all has a medical backing, scientific backing behind it.
Yeah.
And then not fasting the week before your period.
Period. Yeah.
But then playing with it too. So one morning, if you're really, really hungry and just like dizzy and lightheaded, or not that you get that with fasting, but if you are, eat something. So she's very like that. It's like work with, and I'm a big advocate for that. Like pick something up that is like your blueprint, but adjust it for yourself.
Yeah, absolutely. And I think why it works for women, and certainly why it works for my lifestyle, is it just takes the mental burden out of it. You just know I'm doing my fasting, and your body's so metabolically flexible. You can manage your big days without having much food, and that's fantastic. And then when I mean, I could speak for hours about it because I've been looking at Mindy's work for years now. James Dinnick is another one in the States. Yeah, Dr. James Dinnick. So he has very good science behind his work as well. So I always reference those two for my patients, James Dinnick and Mindy Pelz, because no one ever walks into my clinic and says, Kelly, I'm my ideal weight. I'm ready for surgery.
But you know, the interesting thing about us females is I used to be a bodybuilder. So I used to always want a particular body. And when I got that body, I still wasn't happy. And I'm a big advocate. I haven't trained for a few years now, and my body's totally different. And it's at its heaviest. And what I share with women is we always want to lose this or lose that or lose that. And what I share with them is you do the inner work to be at peace with yourself. Now, it doesn't mean you can't change it. Doesn't mean that you can't lose the weight. But even when you do that number, you always want to lose a little bit more, and you never feel it. You feel exactly the same as you feel now. Like you may feel lighter, you may fit your clothes better, but internally you feel the same. And that's a really big thing I want to highlight to women is we always want to go, oh, just 1 kilo more, or just this, or we look back on photos and go, oh my God, I thought I was fat then and I wasn't. That all tells me that it's never about that.
No. And yeah, and I think that's why I love the intermittent fasting, that burden just is off. And women can manage it.
Yeah.
You know, we can't all calorie count, we can't all, and so, I mean, if you go through Mindy's data, so many of the old school's approach to nutrition and diets were very much based on male studies because women are too complicated with their hormones. So, you know, so that's been my biggest thing. But they'd be the two things: intermittent fasting and celebrate your small wins.
I love that conversation. I think you just became one of my best friends. When you were talking about all that stuff, I was like, that wasn't even planned. And I was like, exactly on the same page as me right now.
No, look, I read just some of the questions and I'm like, what is the biggest thing that I've done? I'm like, it's intermittent fasting. Yeah.
Yeah. I love that. And it's just, isn't that just amazing that I've just been reading about all her stuff? Because I saw her originally on the Diary of the CEO, Stephen's podcast. Have you seen?
Yes. Yeah.
So I saw her getting interviewed I watch his podcast often on YouTube. And I saw her on there and I thought, and because my background in nutrition is all based on food as medicine, and going back to our body and our brain and our primal days. And it's like, hang on, we've got the same brain as we had so many thousands of years ago. We've got the same body. we're so lacking nutrients in today's world. Like when you pick up a packet of food, and there's no right or wrong, like I'll have junk food and stuff still, but I'm mindful of, I know that with anxiety and depression and with brain fog and hormones and stuff, when we eat, if you look at what you're putting into your mouth, it's most of the time what's written on the packet, your primal body's like, I have no idea what this shit is. What do I do with it?
Yeah. And so much of that is linked. I mean, the science now coming out about the gut, and it's linked with depression and it's linked with anxiety. Like, it's pretty powerful information. It's new and it's exciting, but that's the same with intermittent fasting. So
100%.
It's exciting to get onto it.
And it's exciting too, because even the study I've done, obviously it's nowhere near what you've done, but with anxiety and depression, when I start working with my clients, it's like finding out what food and supplements and stuff they take, because it can, I don't want people to think I'm saying always, stem from just a lack, being nutrient deficient in vitamin D, especially with COVID, everyone being inside all the time, vitamin C and magnesium and the omegas, and not having dark leafy greens, which just brings your body into the state of just actually having level nutrients. So when we're already lacking nutrients, and then we're feeding ourselves all this other stuff, that food colorings and stuff that doesn't recognize as food, that's what's just going to really tip our anxiety and our depression levels as well.
Yeah, and Mindy's hosted a couple of people on her podcast too, talking about the gut microbacterium and how that has an impact. So it is, so much more important than intermittent fasting.
Fascinating.
It's so good for all of it.
So good. Oh, it's been an absolute pleasure. Now, before we go, where can people find you if they want to reach out to you, ask you any questions, or come and see you for a consult? Where's the best way for them to find you?
Yeah, look, I'm actually in the process of building the website, but I have Instagram, so it's just Dr. Kelly Thornbury. I have a lot of different information going up on TikTok as well, if people are wanting more information, or just emailing our practice, which is just info@drkellythornbury.com.au.
Okay, and I'll put all of those in the show notes below.
Thank you.
Thank you so much for such an insightful and a really bloody enjoyable podcast. Like, seriously, I feel a bit selfish. Like, I know it's a Saturday morning, but my podcast isn't my work. This is a hobby of mine. I just love doing this. And it's literally, I've just had so much fun with you today. So thank you.
Oh, my pleasure. No, thank you. It's nice to have been on.
Thank you so much for listening. I hope you enjoyed today's episode and it has inspired you on your self-care journey. Please feel free to share this with a friend and subscribe over on Apple Podcast. I really love hearing your feedback. So guys, please feel free to write a review on Apple and let me know which part of this episode resonated with you the most. To fall in love with yourself is the first secret to happiness. To find out a bit more about Self-Care Studio or the Studio Chat podcast, head over to my Instagram page, self_care_studio, or on my website, selfcarebybarbarathomson.com.au. Really look forward to seeing you on the next episode. Look after you. And I'll catch you soon. Bye!